Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore, and today we are going to discuss the topic about therapeutic drug monitoring. So first we are going to see the definition. What is therapeutic drug monitoring? So therapeutic drug monitoring is also known as TDM. So the TDM is known as therapeutic drug monitoring. It's a clinical practice to measure the specific drug concentration in the blood and plasma to maintain a safe and effective therapeutic range. In some type of drugs, when we administer the too much high concentration, it produces the high toxic effect. At the same time, when we administer the low concentration, it does not provide any therapeutic effect. So that type of drug, the effect can be individualized from the person to person. In some person, it is response is produced in 15 microgram by ml means. But some cases it is an 20 microgram by ml. So the cases or the doses will be different. So based upon that type of drugs, the therapeutic drug monitoring is also one of the important. So the objectives of therapeutic drug monitoring. What are the objectives of therapeutic drug monitoring? To ensure the optimal therapeutic effect, to ensure the proper therapeutic effect is produced to the patient, and avoid the toxicity, to avoid the unnecessary toxicity in the body, to individualize the drug dose. The person some person intestine, the more drug will be absorbed, but some person the absorption is decreased. So based upon that, we can individualize the drug dose and improve the patient compliance and manage the drug interaction. So these are the objectives of the therapeutic drug monitoring. And next on the therapeutic range, it is divided two types. One is a MEC. MEC means maximum effective concentration. It is a lowest level of effect, lowest level for effect. And next one is a MTC. MTC is nothing, minimum toxic concentration, level above which toxicity occur, level above the toxicity occur. So the best drug which produces therapeutic effect is in between the MEC and the MTC. The drug concentration is between the MEC and MTC is a proper therapeutic drugs. The drug which we can predict, the drug has a proper therapeutic index. And next one, the drug commonly monitored. Which type of the drug we want to monitor the drug therapeutic monitoring? So drug therapeutic monitoring commonly used for drug with narrow therapeutic index. In some type of drug which has narrow therapeutic index, so that type of drug we want to measure the therapeutic drug monitoring system. And high toxicity risk. Some type of drugs have high toxicity risk. So that type of drugs also we want to monitor their therapeutic level. They want to monitor the blood plasma concentration level. So example is, first one is a digitoxin. Digitoxin is a cardio related drugs which is used to treat the cardiac arrest and angina for that type of case. And next one is a phenytoin. It is an anti-epileptic drugs. And lithium, theophylline. Theophylline is used as a cough suppressant agent. And vancomycin and gentamicin is an antifungal drugs which is used to treat the fungal infections. So these are the common example. These are for these drugs we want to measure the therapeutic drug monitoring. So these are the drugs are highly toxic when the amount of drug is increased in the blood. So next, when we perform the therapeutic drug monitoring, after starting the therapy, we want to maintain the steady state of the drug in the blood. For that purpose, we want to measure the therapeutic drug monitoring, and for the dose adjustment, for decreasing of dose or sometimes increase of the dose, we want to check the therapeutic drug monitoring. And suspect of toxicity, if we suspect any toxicity and lack of therapeutic response, if patient come with some problems, we give some drugs but do not have any improvement or do not produce any therapeutic response, for that case we want to check the therapeutic drug monitoring. And renal or hepatic impairment, if person have already renal or hepatic impairment, but we we administered some dose, it can also cause the renal or hepatic impairment. For that case we can adjust the dose. For that purpose, we first want to know how much amount of blood drug which present in the blood. Based upon that, we can administer the drug frequently. So next one, the drug interaction. We want to know the drug interaction and special population, elders, pediatrics and pregnancies, For that type of persons, the dose may be different from the person to person. For that rare cases also, we want to measure the therapeutic drug monitoring. And factors affecting the therapeutic drug monitoring, there are different factors. First one is the age, body weight, and genetic factor, and liver function, kidney functions, and drug interactions, and disease conditions. Okay. And next, the clinical importance of the therapeutic drug monitoring. The prevent toxicity, digoxin toxicity. Digoxin is used to treat the arrhythmia, but in some cases it can cause higher dose can cause severe arrhythmia. So that type of case we use the therapeutic drug monitoring, and ensure the sneezes are controlled, ferritin, and avoid the renal damage. So gentamicin is when dose is increased, it can be cause an renal failure. So that type of cases we want to measure the therapeutic drug monitoring. So these are the examples for therapeutic drug monitoring. Therapeutic drug monitoring is nothing. The amount of drug present in the blood or plasma is known as therapeutic drug monitoring. Okay, that's all about this video, and thank you for watching. Have a good day.